Hello everyone, I'm Chris. Before we start, let's watch our short video of a controversial topic recently, which is the lawsuit of Mr. Johnny Depp, the leading actor of a well-known movie, The Pirate of the Caribbean, to his ex-wife, Miss Amber Heard.
In the video, forensic psychologist Dr. Shannon Curry mentioned that Miss Amber Heard has shown some of the symptoms of borderline personality disorder. But actually, what is borderline personality disorder? Although borderline personality disorder or even personality disorder sounds unfamiliar to most of you, but actually it's estimated that at least 1 in 100 people have borderline personality disorder, also called BPD. For today, it will be separate into 2 parts. The first part will be talking about what it's like to have the disorder and the causes and also the diagnosis of BPD. Here's some problem also called symptoms of a person with BPD, including a significant difficulty controlling and regulating emotions, uncertain of self, which in a psychology term called unstable self-image, having an intense and unstable relationship repeatedly, idealizing people, then intensely disliking or devaluating them in a relative short intervals, feeling an urgent need to avoid being abandoned by other people, even though there's no evidence provided and it's only an imagination. A chronic feeling of emptiness and also repeatedly acting in an impulsive and risky ways. For example, some suicidal posture or threat to other people. People with BPD will be in a great suffer and generating intense sense of guilt, and over 1/3 patient with BPD will eventually commit suicide. However, currently BPD is under-recognized, and the availability of specific help that patient can reach is limited, mostly under the following reasons: ongoing social stigmatization of mental health issues, limited professional training for professionals to treat BPD, unwillingness to seek professional helps. But still, it's treatable, and the rate of successfully cured is high. Let me give you guys a quite simple scenario. Imagine your friend or someone close to you have BPD. You tell them something simple in a daily conversation basis. Let's say you're getting in a new romantic relationship and they're suddenly being triggered and reminded about him or her being abandoned in his or her last relationship, and react to you in a ferocious way. If you've been hurt by them while they are having an episode of instability, after a few times, you must struggle to feel empathy toward them. But always remember, never blame them, and they are not meant to do it. Overall, it's not really their faults. But have you guys ever wondered about the cause of BPD? Actually, the cause of BPD isn't fully explored, and it's believed that it's a combination of biological factors and early life experience, such as trauma or bullying events, that are thought to contribute to the development of BPD. To diagnose BPD in a clinical manner, psychiatrists and psychologists will ought to observe pattern of features mentioned earlier, while those features need to be considered inflexible, long-standing, and also must lead to clinical significant distress or impairment. And in terms of recovery and treatment, so far academia and practitioners believe that the best treatment will be some psychological counseling, which is known as dialectical behavioral therapy. Dialectical means concern with the opposite force which accept and change, as some of the features and symptoms mentioned earlier might affect the therapeutic relationship between the professional and the patient with BPD. It is important to engage professionals that have previous experience dealing with BPD condition patient, as a strong and stable therapeutic relationship is the key point leading to positive therapeutic outcome. If the above treatment possibility have been done, patients with BPD might slowly change some of the unhealthy conditions and move toward to become a healthy person. And to add, strong improvements are possible if the patient is willing to cooperate with the professionals and actively participating in the treatment process.
In this short video, hope I can get you all know more about borderline personality disorder and as well as its causes and also diagnosis. Until next time, thank you for listening. Bye-bye.